So it's a really exciting time for measurable residual disease in acute myeloid leukemia. This is something we've known about for 40 years and has been clinically used at local centers for decades. But really over the past 1 to 2 years, we've really had this great momentum where we're actually harmonizing the way we measure response assessment in acute myeloid leukemia. Essentially, for almost 60 years, we've measured the response to therapy for patients with acute myeloid leukemia using 1950s tools. And we now have updated through the European Leukemia Network the response criteria in 2017, which now has a higher stringency category of CR that's MRD negative. And very recently, just a few months ago in Blood, we published the ELN consensus criteria on how we should measure AML MRD. And that was a large part of my talk, was describing what those consensus criteria are for the measurement of MRD, both by flow and by molecular measures. The second half of my talk was discussing the opportunities opened up by next generation sequencing and some caveats and some work we need to do going forward to make that a realistic way to measure MRD.